Hey everyone, it's Nurse Dani, and today I'm joined by Emily Hayes, certified nurse midwife within the Salt Lake Valley, and we are going to talk about pregnancy myths and facts. We're going to play a little game. And we kind of took the most commonly asked questions on Intermountain moms and turned them into statements that we hear frequently. And Emily is going to help us understand if those are myths or facts. But first, I want you to have and I also want to let you know that we may have some time at the end for live questions. And so if you guys want to ask them, type them in. And then if we have some time at the end, we'll answer them. But I want Emily to have a chance to introduce herself and kind of talk to us a little bit about certified nurse midwives in general, the profession.
Yeah, so I'm a certified nurse midwife. I'm also a women's health nurse practitioner. Midwives, a lot of people think midwives only do pregnancy and birth, but midwives also do well woman care, gynecologic care,
good to know.
Family planning.
So you can go I can go to you in between my babies too.
Yep, you can come for your pap smear and your birth control refill or your IUD or your urinary tract infection and
that's awesome.
All of the other things that are women's health problems and well woman care, annual exams and stuff like that. And then we also take care of women during pregnancy and birth. And a lot of people, another myth, speaking of myths and facts, a lot of people think midwives only attend home births or birth center births. But midwives, the majority of certified nurse midwives practice in hospital settings. So I think most Intermountain hospitals, you can have a midwife take care of you if you have low risk for complications, meaning you don't have chronic illnesses that put your pregnancy at high risk or multiples where you have twins or triplets. If you're not sure, you can always meet a midwife and talk to them and see, am I a good candidate for midwifery care, or do I need a specialist or an OBGYN to take care of me? And midwives, we pride ourselves on providing individualized care that takes care of the person as a whole person, not just your medical care, but your, your mental health and your physiologic health, and really personalize the care so that it meets what your expectations are as well. We really want to be a partner in your health and help people have the most healthy pregnancies and births, but also just live their healthiest lives, which I think is, that's what Intermountain's all about.
Yeah, helping people to live the healthiest lives possible, right? That's our motto. So thank you so much. If people are out there looking for a certified nurse midwife, then she's your gal. Obviously so friendly and nice too. So thanks again for joining us.
Happy to be here.
So let's start with irregular cycles.
Yeah.
If I have irregular cycles, is that a sign that I am infertile?
So yes and no. This is we're going to start right out with gray instead of black and white. No, if you think that having irregular cycles means you'll never get pregnant, or that means if you're using that as your birth control method, I would not rely on that. Irregular cycles can be a sign that you might not be ovulating on a regular monthly basis, but you may still be ovulating irregularly and occasionally.
You just have no idea when, so you don't know when to avoid intercourse if you're trying to not get pregnant, or to have intercourse if you're trying to get pregnant, right?
Yeah, irregular cycles really make it hard either way. If you're trying to become pregnant, it's hard to know, when am I ovulating? Because you don't know when your period's going to come. And we know that with people who have regular cycles, that helps us estimate when somebody is going to ovulate.
So define regular cycles.
Yeah.
What is that?
So if you were a robot woman and you
I like that term.
You were coded and you were going to have a period like a robot, it would be every 28 days. So 4 weeks. We know in reality that it turns out we're not all robots, and that most women have a period about monthly. A normal cycle is considered to be between 21 and 35 days. So some people have cycles that are like every 25 days, any 22 days. And some people have cycles that are every 34 days, every 35 days. Longer than that or shorter than that would be considered, what's going on here? Is there some medical problem that we need to look further into to figure out why somebody is having periods more frequently or not frequently enough?
Okay.
Yeah.
So, speaking of that, if I have cycles that are, you kind of explained this, but I just wanted to highlight this because this is a frequently asked question. If I have periods that differ from month to month, is that a problem? Like if one month my cycle was 28 days long and the next month it was 30 days long and the next month after that it was 32 days long, is that problematic?
No, your body is just, turns out, not a robot. But yeah, if somebody has periods about once a month, that's considered healthy and normal. Some people go months and months without a period. If that's the case, you should definitely go seek out care from a midwife or a physician or another provider to find out why. There are thyroid problems that can cause weird cycles. There are other metabolic disorders that can cause this. And so I'd say one of the most common causes for that is something called polycystic ovary syndrome. From my experience, I'd say that's one of the most common reasons people have infrequent periods or irregular periods.
So how long should I wait before talking with the provider? How many months should go by before I talk to someone about it?
I would say 3.
About 3 is a good
2
number.
to 3. If you miss more than one period, that's not just stress.
And first of all, take a pregnancy test. We're going to get more into that later, right?
Yeah.
Either rule out or confirm that as the cause.
The most common cause of a missed period is pregnancy. Yeah. So always take a home pregnancy test. Some people want a blood test. They think, my home one isn't as good. But a blood test is we can detect a pregnancy sooner, but it's not like better than a home urine pregnancy test. If a urine pregnancy test tells you you're pregnant,
you're pregnant.
You're pregnant. A blood test is not going to give you better information. But yeah, if you miss a period, you've taken a pregnancy test, you're not pregnant. Sometimes people miss a period in very stressful times in their lives. And so if it's a one-time thing, it's not something I would worry about. If it becomes a pattern or you miss another one, that's something's going on and we should try to figure it out.
Okay, good advice. Yeah. When it comes to tracking periods then, will my period app tell me when I'm ovulating?
Yeah, yes and no.
Okay.
Yeah. So
this one's also gray, right?
Yeah. So in a perfect 28-day cycle, ovulation happens halfway through on day 14.
And let's define this too, because I'm not sure everyone knows this. Day 1 is the first day of your period.
Right. Day
Okay.
1 is the first day of your period. So ovulation happens about midway through. The first half tends to vary. The second 14 days are pretty well set. That's the luteal phase, we call, of the menstrual cycle. So a period app analyzes the information you put in. So if you've been keeping track of your periods for 6 months, you're going to get better information out of your app than if you've been keeping track of your periods for 1 month.
So if I'm the person who has cycles that are 28 days, 30 days, 32 days, I'm just going to calculate like an average and put that in.
It's going to give you an estimated day that you're going to ovulate. And so it's not perfect. So that's when I say yes and no. I mean, yes, it's going to give you an estimate, but just like your due date when you're pregnant is an estimate, so are these estimated days of ovulation. The good news for people trying to become pregnant is that sperm can live inside a woman's body for days, up to 5 days. So you don't have to time intercourse perfectly on the day of ovulation.
You have a little leeway.
Yeah. So then that's why we tell folks, if you're not having any problems, you don't need to worry about these apps and only just have sex regularly and you're probably going to get pregnant.
Valentine's Day is coming up. Be spontaneous.
Right.
So if you're trying to get pregnant, but you don't want to worry about all this, like these calculations and these apps and everything, what advice do you have for women about when generally in their cycle they should have intercourse? And then if you're not wanting to have a baby, when you should avoid it?
Yeah. So if you are wanting to become pregnant, I tell people to have sex in the first half of your cycle, right? Because those are the days leading up to that day 14. And that's when sperm can live inside the woman's body for days. So you can have sex but ovulate 2 days later and still get pregnant. So between, when your period ends, or
can you get pregnant on your period? That's another commonly asked question.
If you have very short cycles,
it's possible, like the 21 day.
Yeah. So it's more common as people approach menopause that they may ovulate closer to when they're still on their period.
That's good to know.
So that's your oops baby.
Because you're going to be a little bit older and possibly thinking you've moved on from that phase in life.
Thinking you missed a period because you're going through menopause, but you're actually pregnant.
Well, quite a shocker.
So time, I would say, have sex more frequently in the first half of your cycle than in the second. Because after, an egg lives about 24 hours. And so after that, then there's no way you can become pregnant.
No chance of conceiving.
So the problem is identifying that day that you ovulate. It's not a perfect science, and that's why half of pregnancies are unplanned. Yeah. In our country.
That's a large number, 50%. Yeah. So speaking of birth control, you can kind of calculate it based off of when you might possibly be ovulating, but how effective is that really?
Yeah. If you think about contraception, this is probably one of the oldest methods in the world, right?
Yeah.
Keeping track of your cycles. When you look at studies that look at natural family planning methods, so these are methods that work to predict when ovulation will occur and avoid intercourse during the time that you could be potentially fertile. Those methods are, depending on the study, between 60 and 85% effective at preventing pregnancy. Now, the reason there's such a large range is because there's a large range of people, and we all have different cycles. We're all a little bit different. We're all maybe not perfect. Yeah. And so for some people, it might be less effective. So if that is a number that seems reasonable to you, then you certainly can use these natural family planning methods to prevent pregnancy. But 60% to me, if I wasn't planning a pregnancy, that's not good enough for most of us. And so there are other methods that are 99% effective at preventing pregnancy. The only 100% method is not
abstinence.
Having sex.
Yeah.
So you just need to balance that, how effective it is, with what's important to you.
So when it comes to trying to get pregnant or not, either way, if you had intercourse and you think you may have gotten pregnant because maybe it was around that time of the month when you would have conceived, I'm probably going to panic if I don't want to be, or I'll be super excited and think every little stirring within my belly is due to pregnancy.
Right.
What are the actual first signs of pregnancy, and will I know or feel it before I see a positive pregnancy test result?
That's a good question. So I'm going to say something first, because I think that you brought up a really good point, is that if you're not planning a pregnancy, and you would panic if you were in that moment where you realized, oh shoot, that was not the day to have sex.
The stars may have aligned. Yeah.
Then you don't have to just wait to see. There's something called emergency contraception that delays ovulation or prevents ovulation. That's how emergency contraception works. It's not an early abortion pill. That's another myth that we really need to
I'm glad you brought that up.
Make sure that people understand that's a myth. So the way emergency contraception works is if you had sex this day during a potentially fertile time that was 3 days before you were going to ovulate, emergency contraception tricks your body and just pushes back that ovulation day so that sperm and egg can't meet. So if you were the person who would panic, don't just panic and worry. Go to the pharmacy, go to the counter and say, I need Plan B or I need emergency contraception. And it's available without a prescription. Okay.
And it can delay your period.
Yeah.
Right?
And
so then you think that you got pregnant.
Yeah, because it's delaying your ovulation, it's also delaying your next period. So it's going to mess with
it's
your
important
cycles.
to know that side effect.
Yes. Okay, so if you're the person who is excited that you're like, okay, I think that this was the day. I think we timed it perfectly. I even timed it because I want to have a girl instead of a boy.
Right.
That's not enough. One of the earliest, so you're not going to feel fetal movement before your next period starts. I would say the earliest sign of pregnancy is missing a period. And then shortly after that, fatigue, nausea, breast tenderness.
So if you're feeling that before a missed period, it's probably just PMS because the symptoms are actually the same. Or it could be PMS or it could be pregnancy.
Those
Who knows?
are so similar, right? How many people get breast tenderness before their period? How many people just feel
tired and bloated? And
So probably breast tenderness is one of the earliest. Nausea, vomiting, that usually starts a few weeks into weeks after your missed period.
Okay, good information.
But urine pregnancy tests can detect the pregnancy hormone as early as 10 days after when you think you ovulated. So even before your missed period, I recommend just waiting till your period and you miss a period, because you can spend a lot of money on urine pregnancy tests.
Well, and if you get a negative result before a missed period, that can be a false negative, and so it's just better to wait. And if you see a positive, then you're pregnant. But if you see a negative, you just need to wait and retest anyway. So save yourself some dollars.
Yeah, and worry.
Yeah, right. And speaking of that, are dollar store pregnancy tests any less effective than the more expensive ones?
No, these are all the same. I mean, some have a detection limit that is lower or higher, and some are easier to read. So like the clear blue easy ones,
the digital ones,
very clear how to interpret the information. HCG is the hormone that is detected in a home pregnancy test. That is never made by the body until you're pregnant. So a positive home pregnancy test is a positive pregnancy test is a positive pregnancy test. They all detect the same hormone. Some may detect it at earlier, so you may be able to know earlier than maybe a few days before your period instead of having to wait till your period. But if you've missed a period already, a negative home pregnancy test is very likely to be really negative.
Yeah.
Unless you have variable cycle length. And then you may just be testing too early because your period was going to come a few days later.
So if you have irregular periods, when should you test?
I mean, I still tell people when you expect that you would expect it. So often day 35 is like the likelihood that you haven't had a period and you're just going to is very low when we look at a normal cycle is between 21 and 35 days. So by day 35,
it's time to
reasonable to wait to go ahead and find out.
What about ways to boost fertility? Are there foods I can eat or over-the-counter products
oysters.
That I should use?
No, I'm just kidding. I would say being healthy, right? Eating nutritious foods, fruits, vegetables, limiting sugar, don't smoke, don't drink alcohol, exercise. Being an overall healthy person is going to maximize the chances that your whole body is functioning normally, including the parts that we're talking about, your ovaries and your uterus and your pituitary gland.
Releasing those hormones.
Yeah. You're more likely to have struggles with fertility if you're underweight or obese, overweight and obese. So maintaining a healthy weight and being as healthy as you can be in terms of nutrition and diet and avoiding harmful substances are the best way to maximize your fertility.
That's actually one of the myths on well, I guess I should let you define it, but one of the things on here is smoking's okay as long as you quit after you're pregnant.
Yeah, I mean, smoking isn't good for us regardless if we're pregnant.
Yeah.
And if you are a smoker and you find out that you're accidentally pregnant, certainly it's not too late to get some benefit to stop smoking as soon as you know. But
for you and your baby.
Yeah, for you and your baby. Because guess what? Babies need healthy parents to be able to help them through their whole lives. And smoking certainly is going to decrease the chances of, of that. So yeah, smoking, I would encourage anybody who is planning a pregnancy to quit smoking before they become pregnant. Absolutely.
For your own well-being and
for your baby.
Yeah. Back to ovulation. Are there any obvious signs of ovulation that I should be looking for, or can I only go off of trying to calculate it based off of my cycle length?
So there are some signs that you can watch for. One of the most common things that many women may have already noticed, and now that they hear this today, they may go, oh, That's what that is. But I'm going to just warn that we're going to kind of talk about gross things.
We talk about lots of gross things on Intermountain Moms, so it's all good.
So our bodies make a special mucus called spin barket mucus. I don't know.
Spin barket.
Yes.
I have done this for so many years and I've never heard that.
Yeah, and it's this clear, stretchy, kind of egg white consistency discharge that comes from the cervix. And it is the elixir of life for sperm. So sperm can live in that kind of fluid for 5 days. But the other kinds that are sticky or more dried, they're not going to survive. So if you have that mucus, it means that's a sign that you are about to ovulate and your body is getting ready to become pregnant by getting ready to keep happy sperm alive.
So that's one way you can like track cervical mucus changes and potentially be
kind of know it's on the way. There are little test kits, little test strips called ovulation predictor kits that you can buy at the drugstore, same place that you buy pregnancy tests, and they detect a surge in the hormone called LH that precedes ovulation. So they can help predict that, okay, I'm going to be ovulating in the next day.
So a positive result doesn't mean I'm ovulating right this second. It just means it gives you a time frame.
Right, because when you look back at what we talked about right at the beginning, that when should you have sex if you're trying to become pregnant? Once you've ovulated, that pretty much that ship has sailed, right? We want to catch it as it's coming into the harbor.
Yeah.
Bad puns here. But so spin barket mucus is similar to that. You want to know what's coming because you want to be able to have sex in the days leading up to so that sperm are present when you release the egg. And then
it's waving at the shore.
Yep, I'm ready.
Back to our analogy. Yeah.
So then the other thing that you can do to know that you have ovulated, and this is one that can help you detect your pattern. So just like the app is going to predict about when would I expect my body to release an egg, you can do something called basal body temperature monitoring. Have you heard of that? So basal body temperature just means using a regular old digital thermometer and taking your oral temperature in the morning before you get up. You can't even have gotten up to go walk to the bathroom to go pee. You have to do it before you get up out of bed. And that is your temperature when you've been sleeping for 8 hours. At the beginning of your cycle, it's a few tenths of a degree lower. And then at ovulation, you get a few tenths of a degree higher. And then it stays high until your period comes, and then it goes back down.
What if you get pregnant? Does it stay high?
Yeah, so that's one thing you could do if you wanted to chart your basal body temperature. If you just, in addition to not getting a period and my basal body temperature is staying high,
up. Go get a test and confirm that is the cause.
Yeah. Now, once you've had that temperature shift, again, that ship has sailed, that you've ovulated.
This helps you in retrospect.
So that helps you know what's my pattern so that for the next month.
I typically I'm seeing this elevated temperature on like day 18, then you know that
I've got longer cycles. I was going on day 14 and trying to time my intercourse right then, but I needed
to be a few days off.
Yeah.
So speaking of timing things, right, that's another commonly asked question we get is, should I have sex every day or every other day in order to increase my chances?
Yeah, I think that the fertility experts still tell us every other day. Again, in somebody who is not already struggling with fertility, just have sex. Don't worry so much, right?
Yeah.
Just have fun with it.
Yeah. Yeah, and it doesn't, if you think to yourself, I want to have a baby, you've talked about this with your partner, this is something you want to start doing, you don't need to even pull any of this out in the beginning. Just don't be on birth control. Just
stop using whatever you were doing to prevent.
Yeah, and how long does it usually take most couples to spontaneously conceive?
Yeah, about a year. It could be the first month and it could be the 12th month, and both of those are in the range of totally normal.
And we always just tend to hear about the people that they crossed paths in the hall and got pregnant.
Myrtle.
Yeah. And that's not the norm. So no one should expect that for themselves or feel bad if a month or 2 or 3 or 4 goes by without conceiving, right?
5, 6, 7, 8, 9, 10, 11,
Yeah.
12. And even, so that, when you look at, like, this is the statistical range.
Mm-hmm.
So that's most couples. But there is still, at the end of that, if you think about a bell curve, at the tail ends of those bell curves are still people in the normal, they're the 2.5% here and the 2.5% there that, like, walk in the hall and get pregnant. They're on one end. And on the other hand, it could be another year and they still could become pregnant and still be within the range of normal and not have needed any treatment for fertility or anything. They just took a little longer. So for folks who are like, there's something wrong with me, I've been trying for 4 months, I'm not pregnant yet. Yeah, that's still totally normal.
Is there
on the flip side, though, I have people who sometimes say, okay, so I want to become pregnant in June, so I want to take out my IUD in January because I know, it could take about a year, so 6 months split the difference. And I'm like, you need to be open to a pregnancy
as soon as it's out.
As soon as it is out. I have had lots of people come back for their first prenatal visit and they never had a period. They went from an IUD to pregnant. So this is the first lesson in parenting, which is you really don't have that much control over this process.
Yeah.
And sometimes you just need to be open and then don't worry about all of the calendars and the apps and the ovulation predictor kits and the, just
see how things go.
Just see how things go.
Is infertility something that runs in families? Like if, as I'm trying to plan my family, like you were saying, and I have sisters that had to try for a long time, or my mom did, is that something that I should take into account?
Not necessarily. So if you exhibit symptoms that are similar to what your sister experienced or what your mother experienced.
Like irregular periods or something
irregular periods, really painful periods that can be a sign of endometriosis. Or like you said, irregular periods that could be a sign of thyroid problems or polycystic ovary syndrome.
And those things can run in families?
Yeah, certainly. So, but if you are having regular periods and you have PMS symptoms and you have a period about once a month, don't count on that it's going to take you fertility treatments and all of that to get pregnant. You couldn't get pregnant.
That is also very good advice. Everyone needs to know that.
I think another one of our myths was if I haven't gotten pregnant and in these 4 months, that means that I can't get pregnant. And a lot of people kind of think that, and so they stop using contraception. They think, I've gotten by this far, so I'm likely to get by in the future.
Long term.
Yeah. But if you're having regular cycles, then you're probably producing an egg every month. And so each new cycle is a brand new start over chance of getting pregnant. It's not dependent on the 4 that were previous. It has nothing to do with those 4 previous months. This month is its own new chance.
Its own shot.
Yes.
Yeah. Is there actually like a higher chance of pregnancy on certain days leading up to ovulation if you're trying to get that precise about it?
No, I don't think so. No, I don't think so. I mean, maybe if we start I don't know that the studies tell us if you have sex on the day 3 prior to ovulation, the chances are no.
So it sounds like there's some common themes here. We're hearing that if I wanted to get pregnant, then I should just go off of birth control. And also, I want to bring this up, like if I'm using certain types of birth control, it may or may not delay the return of ovulation depending on what you're using. Like the Depo shot, we get a lot of questions about this.
One.
Yeah, that's the only exception, right?
Yeah, there are some people who it takes a few months after, say, stopping the pill, but that's pretty darn rare. The one that is really pretty much, if you're planning a pregnancy in the next year, you probably should choose a different contraception method for now, is the Depo shot. It can take up to 10 months for your fertility to return. Now, again, when you're using it as a birth control method, don't think that it works for 10 months. right?
Yeah. So if you skip your injection and you didn't want to get
You're like,
pregnant,
they told
you still
me
might.
it will work for 10 months. No, it works for 12 weeks. But for some people, it may take longer to wear off. So you don't want to count on that as your contraception method if you're trying to prevent pregnancy. And yet you want to maybe choose a different method if you think, I want to become pregnant this year, because it could take up to 10 months to wear off.
So it's all about your goals. Do you want to get pregnant? Do you not want to get pregnant? And so sounds like it would be a good idea to come see you if I wanted to have a baby, and you could talk to me all about the options that I have for birth control. If I want to delay it a little bit, kind of talk to me about my timing and what would be ideal in life. My health history to determine what would be best. Should we get some things managed before you conceive? A preconception appointment is actually a really important piece of the puzzle, right?
Yeah, I just love it when I have somebody come in for their preconception visit. We want to talk, are you up to date on your immunizations? Are you healthy weight overall? Do you have periods that are regular and are, you're likely to be ovulating?
You can receive all this education in this visit as well.
Yeah. Big one that I just thought of when we were talking. And so if I want to become pregnant, I'm going to stop whatever I'm doing to prevent pregnancy. If I have an IUD, I have it out. If I am taking the pill, I stop taking the pill. If I'm using condoms, I stop using condoms. And 3 months before that, I'm going to start taking a folic acid supplement. That's the huge one. I think people think, I'm going to take prenatal vitamins when I'm pregnant. But the most important time to take prenatal vitamins is the 3 months leading up to a pregnancy and the first 2 weeks of pregnancy before most people even know they're pregnant.
So you said that 50% of pregnancies are unplanned in our nation, so there is a backup plan, but it should not be the plan. A lot of the foods we eat are supplemented with folic acid to help prevent spina bifida, which can happen if you don't have enough in your system, right?
Yep.
But sounds like we should be thinking about pregnancy long before we actually want it to happen.
Right, which is why now the recommendation is if you could become pregnant, you should just be taking a folic acid supplement.
That means most women. Yeah. The potential's always there.
Yep, it's just one last, like you said, what's our insurance policy?
Yeah. Any last parting words of advice for women out there who are listening?
Yeah, so I think that, again, we've said it, but I'll say it again. If you're having regular periods, you have PMS symptoms, you're having a period about once a month, and you're having sex, you're probably going to get pregnant within the year. Whether you want to prevent that or you want that to happen, it just depends on your goals. We tell people, go seek out health care, right? Go find out if there are problems with fertility if it's been a year and you haven't become pregnant yet. There are a few exceptions to that. I tell people if you're not having regular periods, then
you shouldn't have to wait around a year.
Don't wait a year. This is a sign that your body isn't regularly ovulating. The other thing we tell folks is if you're 35 or older, 6 months is the number. It's not because when you're 35 that it's just normal to get pregnant faster. It's that as we wait longer, on the other end of that time is that we might want to start things sooner because we want, we're not as likely to become pregnant in any given cycle as we get older. So if you're 35 or older and you're wanting to become pregnant and you've been having regular intercourse for 6 months and you have regular periods, then you should come on in. Don't wait a full year.
That's a perfect way to end. I think that's probably the biggest question in women's minds, like what's normal, what's not, when should I get checked out, when is it okay to continue trying? So thank you so much. Hopefully this information has been helpful for everyone who's been listening. And Emily, tell us one more time where everyone can find you.
Oh, yeah, thanks. So my name's Emily Hayes. I'm a nurse midwife, and I work at Southridge Clinic in Riverton Hospital. And I work alongside other nurse midwives that can also see patients at Altaview Clinic. And we do all of our births at Altaview Hospital.
Awesome. Yeah. Well, your patients are lucky to have you.
Oh,
thanks again.
All right. So good to be here.
Thank you. And of course, if you guys have questions for me, you know where to find me on Instagram, YouTube, and Facebook, Intermountain Moms. Thanks for joining us.